So simulation is an opportunity to be exposed to any number of different clinical situations that you may have never been exposed to before, or you're exposed to infrequently, or that you've learnt about and you have all the knowledge, but you've never actually encountered in real life. The debriefing conversation is the most important part of what we do. It allows us to send participants in and experience the scenario in question, and then to go back and have conversation about it. And that conversation should be open, and you discuss the events of the scenario and to break them down and to analyse what's happened whilst things are still fresh, and then take any learning forward into future practice. What we try and do is provide a safe learning environment. That safe learning environment is central to everything that we do. So the Simulation Centre is made up of a 2-bedded ward area. We can change it into anything that we want to. We've changed it into a doctor's surgery in the past. We've got a dedicated debriefing room where we can stream what happens in the sim suite.
We use a lot of audio-visual equipment in our simulation sessions. Mostly that's to stream to other groups of staff who are watching the scenario themselves. SimView application allows us to stream video from the scenario to other rooms so other people can see it. It allows our debriefs to be a lot slicker and a lot more understanding for the people watching and experiencing the scenario themselves. We use the SimMan a lot, SimMan 3G and our GoMod mannequin. It can do a various number of different things, from breathing, actually showing breath through the mouth. So obviously when people are looking for signs of life, they can feel the breath on their face or on their hand. His chest rises and falls, he's got pulses. We can take blood from him, we can connect him up to our monitors, which just means that we can get an accurate reading of blood pressure, SATs traces. We can do 3-lead ECGs, 12-lead ECGs. Can react to light stimulus.
We've got a Sim Mom who we use for our midwifery students, for our medical students. We've got a Sim Junior who simulates sort of a 5 to 8 year old. Sim Baby can be used to simulate paediatric emergencies. We do in situ simulation as well. So we take the mannequins out into the clinical area and we can plug the mannequin into a ventilator. We can intubate him, ventilate him, and he responds as you'd expect a real person to respond on a ventilator.
We can also use simulation to test the actual environments we work in. Simulation can be used to test new protocols and procedures before they're incorporated into clinical practice. It can be used to help plan and test the design of new work areas. The ability to use simulation to test these environments can save time in reducing the need for future redesigning. It can save money by identifying how an area can be managed efficiently. But most importantly, it allows staff to identify the processes, the protocols and the physical layout needed to keep our systems as safe as possible and enable us to deliver the best care to our patients.
Simulation is not the place to teach people how to do things. Simulation is the environment in which that knowledge should be tested. What happens in sim stays in sim. Be involved in a conversation where there is no judgment on their performance. It's more about what they can learn from that experience and what they can take forward into their practice moving forward.